In Colombia, 1 out of 3 newborns suffer of a congenital heart disease, turning heart failure as the most common cause of death on children under 1 year old. Additionally, 14% of babies that are born with this condition do not survive more than a month, and the 30% die before they turn their first year. Also, while the healthcare system should be helping 150 children per million inhabitants, only about 2,000 are intervened. With this in mind, Fundación Cardioinfantil has made unimaginable efforts in order to change this reality and help cure Colombia's children's hearts for over 47 years. Furthermore, they also have concentrated their strengths on helping multiple diseases as well, positioning themselves as the #1 hospital in the country. Now this is Sara, Financial Director of Fundación Cardioinfantil for over 4 years. Since day one, Sara has had the objective of helping the hospital deliver the best service possible, and even though the pandemic caused important economical obstacles, Sara hasn't given up.
Our top priority is maximizing profits in order to be able to serve the community by attending more patients that suffer all types of diseases.
On the other hand, Sara mentions that in addition to economical return increment, there are other priorities that have been important for the hospital's performance. First of all, finding financial resources at the lowest cost and make all the donations that reach the hospital last during a long period of time has been crucial in order to keep savings and avoid a possible economic breakout. As well, choosing the best equipment that they can invest in and optimal infrastructure at the lowest cost with the best technology has helped a lot with their doctors' performance. On the other hand, finding opportunities for efficiency without having waste, and finally keeping their team motivated. Now, Sara says,
all of our team knows that they should keep their focus in order to provide the best well-being to our patients as possible.
Furthermore, one of the challenges the hospital has had to face over the last year was the pandemic. Of course, they had the responsibility of attending patients with COVID as their first priority, which meant leaving behind other sorts of services because their main focus were patients that had the virus. Also, they had to control a lot of patient flow and access due to the fact that they still needed to maintain the hospital as a safe and sanitary place. Lastly but not least, they invested a lot of resources on the well-being of the hospital's team.
The second challenge was to maintain the crew motivated and strong. A lot of workers were afraid of getting the virus, so their main objective was to increase the team's attitude and strength in order to keep an capable work. In addition, they implemented a couple of solutions, as for example, daily meetings, investment on high-quality safety equipment, and a donation program that helped them maintain their resources. Finally, Sara mentioned that knowing how to manage resources was crucial, not only because many people's lives were at risk, but because they also had a social responsibility with not only patients but with staff and doctors. As well, she says that at the hospital, everyone should be treated equally, and all of them needed to work as a team because furthermore than working, they were saving lives.
Overall, in order to be a good healthcare leader, it is crucial to have the ability to have a mix between sensitivity to the well-being of people, patients and staff, and technical ability and financial knowledge. Obviously, taking into account the needs of people by investing responsibility without having waste. The final reflection is that no matter how hard and uncertain the future seems, teamwork, resource efficiency, and motivation are the 3 key elements for success and compromise. And as Henry Ford said, coming together is a beginning, staying together is a progress, and working together is a success. Thank you for watching. We are Sofía Herrera, Mariana Sánchez, Sara Osorio, and Gabriela Gonel.